Hello, I'm Dr. David Deci, the Assistant Clerkship Director for the Primary Care Clerkship. I'm here today to talk with you about assessing medical student performance in the area of public health while rotating in your offices. As you know, successful and effective physicians must be able to help patients navigate through the complexities of the healthcare environment, as well as leverage community and system resources to enhance patient care. Evaluation of learner performance in the clinical setting is often challenging. Recently, the University of Wisconsin School of Medicine and Public Health has added 2 competencies in the assessment of medical students. These competencies are included under the systems-based practice category. These competencies focus on the student's ability to view patient care within a multi-system perspective and the student's ability to identify and utilize community and system resources to promote better patient outcomes. Learner evaluation is anchored by behaviors that can be described as advanced, competent, needs improvement, or unacceptable. Advanced performance indicates that a student takes the initiative to address the impact of social, economic, and environmental influences upon patient care. Competent performance means that a student spontaneously recognizes these influences, while a needs improvement performance identifies a student who recognizes these influences only if prompted by the preceptor. Unacceptable performance occurs when the student rarely, if ever, recognizes the impact of social, economic, and environmental influences, even when prompted. The following scenarios will help guide you in assessing learner performance in these 2 important areas of public health and patient care.
Dr. Jones, Mrs. Smith is a 52-year-old woman who's coming in for a follow-up of her diabetes. Her sugars are high, running in the 300s, and her last A1C was 12.2%. She's just on metformin and glipizide now, but I think she needs to start insulin.
So, Megan, you have correctly assessed that her diabetes is uncontrolled and needs some combination of more aggressive management.
Yes, we learned in pharmacology that insulin should be started earlier in the course of diabetes. Her pills just aren't cutting it.
Certainly insulin may be a part of the answer to better diabetes control for her, but can you think of maybe some other reasons why her blood sugars may be so high?
Well, she may not be compliant with her pills, but really I just think she needs insulin.
Is it possible that she's just not taking her pills as we prescribed them? Did you assess how she was actually taking them?
Well, she said she was taking her pills like you said, but she wasn't able to name them all.
Okay, well, let's talk to her about that. And also, did you have a chance to check with her about her own feelings about starting insulin?
Yes, I told her all about it, but I get the sense that she may not be compliant with it. She seems kind of confused. I wonder if she's developing memory problems.
Well, let's go in and see. We'll check that out.
Megan, in this encounter, is at an unacceptable stage. Even with repeated cueing and prompting, she does not consider broader environmental, economic, social, cultural, or behavioral systems on health. Hopefully, with feedback, she will progress over the rotation. Let's see how she does with identifying and utilizing community and system resources.
Dr. Jones, Mrs. Smith is back for follow-up of her diabetes. Last visit, we learned that she was forgetting to take her medications a lot because of being stressed out and busy with her husband's illness. So we changed her to once-a-day pills and suggested that she use a pill box. She's been doing that and has been taking her medications religiously, but her blood sugars are still high, running in the 200s with no low sugars. We talked about her diet, and she said she doesn't have time to cook or make healthy meals, and she's eating out a lot. She would like to talk to a dietitian about healthier choices and meal planning. Money is tight too. Are there any farmers markets around here?
Well, thanks, Megan. A dietitian sounds like a great idea. I'm not sure about the farmers markets. Do you think you'd be able maybe to do a little research on that? I think many of my patients here could benefit from that as well.
Sure, I'll look that up and make a handout.
And what do you think about her medications?
I do think she would do better on insulin, and she said today that she thinks so too. She's a little nervous about the shots, but is ready to give it a try.
Great. Have you seen a patient get started on insulin before?
Yes, but only in the hospital. I think the nurses and pharmacists showed the patients how to do the shots. Is there someone in the clinic that could do that?
Yes, our diabetic educator and pharmacist can certainly work with her to provide her with the training and the supplies that she needs to make the insulin start successful.
As always, look for patterns of behavior and response to feedback. A student who starts the experience requiring coaching or prompting in these areas, but is spontaneously recognizing opportunities by the end of the experience, should be deemed competent.